I couldn't imagine watching maybe a YouTube video or even reading an article on the news saying that I had plastic surgery, despite interviews of me saying I didn't. I just couldn't imagine it. Like listening to people saying that there's evidence that you've had plastic surgery, and I would be sitting there like I'm in a parallel universe. Like, thank you for alleging that I've had plastic surgery, but I mean, this is the most bizarre allegation I've ever heard in my entire life. Well, I mean, that's just what Jennifer Lawrence has been dealing with. And if you want to hear my thoughts about Jennifer Lawrence and some online personalities like Lorrie Hill, please stay tuned. Hi, everybody. I'm Dr. Jonathan Zelken. I'm a board-certified plastic surgeon in Newport Beach, California. A lot of you have been asking me to perform more videos about celebrity plastic surgery and sort of my thoughts on the topic. And I've made pretty popular videos in the past about buccal fat pad removal and other things like that, especially as they apply to certain celebrities like Chrissy Teigen. But the truth is, it's not my favorite topic to speak about. But enough of you guys have been asking me and sort of mentioning names like Stephanie Lang and Lorrie Hill that I was compelled to do a little bit of research. And I was also looking at sort of like, plastic surgery news to see what sorts of topics that we can look at and what sort of topics are relevant in the plastic surgery news today. And a few things sort of came up. The first thing is there's a lot of allegations that Jennifer Lawrence has had plastic surgery. She's recently been cast as the star of a new film on Netflix, and I think it's called No Hard Feelings. It's a great, really funny film. I actually saw it myself, and it sort of has inspired a lot of people to wonder how her face has changed so much and what could have caused this. It couldn't be anything but plastic surgery. And then I also looked at YouTube videos about the topic, and not surprisingly, Lorrie Hill's name came up first. And when I watched her 11-minute summary of Jennifer Lawrence, I think it was 11 minutes, I was taken aback a little bit by her straightforwardness and her assumptions that plastic surgery were done on Jennifer Lawrence, especially in the light of her own interviews saying, "I promise you, there's been no plastic surgery." So as a board-certified plastic surgeon, I feel compelled to step in. But before I do, I want to talk about plastic surgery and celebrities as a whole. It's sort of a controversial topic whether or not the public is should be privy to, secret knowledge about plastic surgery amongst celebrities. Celebrities or actors, are humans, just like you and I. And so laws that apply to private health information and protected health information really should apply to all humans and not spare certain humans as an artifact of them having some moral obligation to tell the truth. They're not politicians. And the truth is, a lot of actors and actresses are very public about their plastic surgery. And names that come to mind are like Sia or Kaylee Cuoco, Izzy Azalea, and most famously Dolly Parton. But one thing that also comes to mind is that there's a lot of discussion about how these celebrities have some moral obligation to the community at large to basically come clean about having had plastic surgery, because a lot of people have a sort of godlike vision of these celebrities and really want to achieve what they have and may or may not look as naturally blessed as these celebrities. And to know that to achieve this result, plastic surgery was the conduit would really help a lot of people, make it day to day. That's an argument for celebrities coming clean about plastic surgery, but I kind of want to speak about the counter argument. I think that celebrities are also entitled to the same privileges as keeping things secret and investing in their faces and bodies as they wish without necessarily having to share that to the public. That's fine, and if somebody says they didn't have plastic surgery, Zelken's rule is that if somebody says they didn't have plastic surgery and there's no scars to show for it, then we have to assume that they didn't have plastic surgery. And I will also sort of disassociate fillers with plastic surgery, because a lot of this bad plastic surgery or botched plastic surgery that we see or is alleged about celebrities and famous people really, in my opinion, is filler. And I think Madonna's a great example of that. You know, even swelling after surgery makes people look really sort of bloated, and that can also, I think Demi Moore is a great example of that, can also make people look botched, at least for a short time. But in the absence of post-surgical changes and obvious evidence of surgery, it's just unfair to say that somebody's had plastic surgery. And the best example of this is Jennifer Lawrence. Having seen that film, and she's a 33-year-old woman, I didn't particularly see any major change with, you know, comparing her to like Katniss and other films that she was in maybe 10, 15 years ago, Silver Linings Playbook. She's 33 years old. She just had a kid, and that does take a toll on a woman's body and face. So when I look at her now, I think she's gorgeous, and I think a lot of the changes that we see are more related to makeup, especially with her eyes and lips, than with any evidence of plastic surgery. So when you are assessing a patient and you are basically ascribing to them that they've had plastic surgery, it's kind of hard to do in the absence of scars. When I watched Lorrie Hill's analysis of Jennifer Lawrence, she alleges that the actress had alar base reduction, mid-facelift, cheek implants, subsequent cheek implant reversal, fat grafting, fillers, blepharoplasty, lip lift, lip fillers, and something called a V to the Y plasty, which I've never heard of. I think she meant V to Y plasty. But when it comes down to it, that's a lot of surgery. And even in the best of hands, to have that much surgery by the time you're 33, you're going to look kind of funny. And I think for someone to look so naturally beautiful and to allegedly have so much surgery is an unlikely pairing. Now let's go back and quickly assess Lorrie's credentials to make these allegations. Lorrie herself, and I did a little bit of background research on a website called Wikitubia, which looks at sort of influencers and influential people in their history. Lorrie is in her mid-40s. She's a mother as well, and she studied to be a dental hygienist. She doesn't have any medical training, especially plastic surgery training, except for the fact that she has been under the knife, admittedly and openly herself, which is great. I guess she had a bad rhinoplasty years ago, and she had it subsequently repaired, which made her life a lot better. She's had a facelift, and she's had other procedures like a lip lift. So she is, I think, particularly well qualified to sort of weigh in on how people might look after these procedures, but she's missing one big picture item, and that is when you have a brow lift, when you have a mid-face lift, when you have a lip lift, there are scars to show for it. And the only scars that I think Lorrie identified in her analysis of Jennifer Lawrence were two small white reflexes on the inside of her nose and a left upper eyelid scar that was probably 4 or 5 millimeters. If you've had children or you've had a few drinks, I think a lot of people know that this is a very, very common area to hit. You've got a bony prominence under it, and any small blunt trauma to that region can easily split your upper eyelid, causing laceration. So a scar in that region is as likely or more likely to be post-traumatic in nature than to be post-cosmetic surgery in nature. In addition, the white reflex of the nostril sills is an anatomic feature, and that's a landmark that we use, for example, when we're doing cleft lip repair or alar base reduction. The biggest attack that I have on Lorrie Hill's analysis is that she kept calling photos befores and afters. Befores and afters really should be taken seriously, and they should be standardized. So if you're gonna analyze a before and after, it should be in the same lighting, same setup, same makeup, same life stage. I think when you are looking at the nose at different angles, it's very easy to see significant changes, especially in an oblique view. You can see a bump on your nose where you can't see it necessarily in a lateral view or profile view. The other thing I would note is that the lighting and the head position change a lot. And also there's weight fluctuations. When you're 18 years old and you're 33 years old and you had children, your anatomy, your hormones, your whole endocrine system is going to change a little bit. And that's going to reflect on the face. We've seen this before in famous persons like Bella Hadid and Candace Cameron Bure from Full House. When you age, your face will naturally slim. Mine did too. If you looked at me in college versus now, I definitely look a lot slimmer now, even though I'm probably 30 pounds heavier. I think what it comes down to is this. Misinformation is an epidemic that plagues us all. We see it mostly sort of in the political environment, but plastic surgery and plastic surgery analysis and celebrity analysis should be held to the same standards. So I'm not saying that Lorrie Hill's wrong. I actually think that the analysis she did was really thoughtful. I think that the video she made was very interesting to watch, and there was a lot of befores and afters. That she called befores and afters, which was just a thoughtful analysis of serial images of this actress through space and time. But when it comes down to it, she's not qualified to weigh in on whether or not somebody had surgery, and I don't think she has any ethical or moral privilege to be able to assert that somebody had plastic surgery when they themselves would say that they didn't. I do think that Jennifer Lawrence probably had fillers in her cheeks and her lips and things like that, haven't we all? But when it comes down to it, there's no scars to show that she's had a mid-facelift. There's no significant changes suggesting that she had cheek implants or subsequent reversal. And most importantly, the reason that I'm speaking up about this right now, and I know it's a controversial topic, and I do respect Lorrie Hill, but I want you to know that to achieve these looks, you don't have to have plastic surgery. I think it's important for people to know whether or not somebody did have it, if they want to achieve a certain result, or they lament that they can't naturally look that way. But to normalize plastic surgery in such a way is to say, to look like Jennifer Lawrence, you have to have $100,000 of surgery by the time you're 33 is equally dangerous. And so if you have concerns or you have certain goals, it is incumbent upon you to speak with your plastic surgeon or a plastic surgeon in your community and ask whether or not your goals and desires can be met with plastic surgery, not to assume that plastic surgery is necessary to look like Jennifer Lawrence. I would say that Jennifer Lawrence shows no evidence whatsoever of having upper blepharoplasty surgery or a facelift. I mean, she probably has had fillers, certainly lip fillers, but that's sort of it as far as my analysis of her face. So with all due respect, Lorrie, I do appreciate everything that you do, and a lot of my own viewers have recommended that I seek you out, and so if you're watching this video, thanks for doing what you do, keep doing it. But for the public at large, I definitely want to warn you that misinformation can come in many flavors, and sometimes when you least expect it. And so you should never assume from a single source that somebody's had plastic surgery or what plastic surgery is without thoroughly analyzing the references, resources, and most importantly, the subject's own testimony. Thank you so much for watching this video. I'm sure I'm going to get a lot of comments below. Don't hesitate to subscribe. I will try to do more videos like this, and I hope that my message comes forward in a positive light. Have a very happy holiday.